Welcome to Today at Wayne, a podcast that engages and informs the Wayne State University campus community. With news, announcements, information, and current events discussions relevant to the university's goals and mission, Today at Wayne serves as the perfect forum for our campus to begin a conversation or keep one going. Thanks for joining us. Welcome to the Today at Wayne podcast. I'm Darrell Dawsey. In a nation 2 years into its fight with the deadly coronavirus, the importance and impact of public health and medical expertise has never been clearer. And the need for a medical workforce that is as diverse as it is competent and innovative has also been dramatically underscored. The Wayne State University School of Medicine has long understood these needs and the challenges that go with them. And in its ongoing effort to respond, the university continues to find new ways to promote and practice diversity. In one of its most significant recent moves, the university hired Donovan Roy, Ed.D, to take over as Vice Dean of the Office of Diversity, Equity, and Inclusion. Raised in southwestern Los Angeles County, Roy was an All-American student athlete whose team won the state football championship before he was recruited to play college football at the University of Southern California. Roy eventually wound up earning his bachelor's and master's degrees from a college in Nebraska before earning his PhD in educational psychology from USC. Now, after stints at such institutions as the Children's Hospital of Los Angeles, USC, the David Geffen School of Medicine at UCLA and Western Michigan, Roy joins the administration here at Wayne State University. And he comes bearing a deep commitment to community and a strong vision for his role at the School of Medicine. And he's here to talk with us a little bit about that commitment and that role. Welcome, Donovan.
Thank you very much for having me here, Darrell.
Absolutely. Great to have you. Great to have you. So let's get into it. Just start off by telling us a little bit about your office, what that office does, and kind of what your role is over there.
So our office here, we're committed to increasing the diversity here on our campuses, not only with our students and residents, but also too with our staff and faculty. So my office here is really to support and provide training opportunities to really talk about what the experiences are like from a standpoint from being from a BIPOC community and the importance of having more representation of the patients that we work with here in the city of Detroit. So my job has been tasked to really develop opportunities and engagement when it comes to working with high schools, elementary, junior high, then undergraduate campus, but also too, we're definitely committed to the community, really reaching out there and developing program to really support the communities, not only academic stuff, but the health to have more healthier people in the city of Detroit. So we run here at Wayne State, we have the first ever post-bac program at a medical school. Our post-bac program is over 50 years, and that program is here housed out of my office. We also too have other opportunities for pathway programs to get students in medicine. So we provide a variety of opportunities. We do consultations on about diversity and how we should show up here as an institution relating to working with certain populations.
Now, the post-baccalaureate program that you mentioned has been one of the tools that Wayne State has done a great job of using to try and improve diversity at the School of Medicine. Before President Wilson arrived, I don't know if you know, but there was a little bit of a history of us kind of falling down on some measures. But since he's been here, we've renewed that commitment. We've really stepped things up. And you and your office have been actually integral even before you arrived, and certainly now that you're here, in kind of helping to promote diversity and help push his vision. I'm kind of curious, what are your top priorities in your particular role, and how do you plan to achieve these objectives?
So there's a couple of priorities that for the first year that I really want to focus on. I started in this position in November, so one of the things that I was tasked with was try to provide to increase the current applicant pool of they call URIM, underrepresented in medicine students. So what I have, since I've had stints at other institutions, I reached out to some of my colleagues at the undergraduate campus to get some of the some students who meet our mission here at Wayne State to apply to our medical school. So I was able to get about 15 to 20 students to submit their application. And Dean Schweitzer commitment to the institution about increasing the URM population here on our campus. He really met with me and said, "This is my priority, Donovan. I really want to increase the URM students. So could you reach back to some of your colleagues across the nation and ask if there are any students that meet our mission?" So Dean Schweitzer has been very instrumental in me really driving more opportunities for students. He also too allowed me to go on the undergraduate campus and facilitate office hours. So that's part of my mission. My mission is actually to be on the undergraduate campus twice a week, really being able to meet with the different programs that that will turn into feeder programs into our medical student school, and also to work with the counselors, work with students to do more intrusive intrusive counseling to make sure those students are competitive applicants. So that's one of my really big goals, is to really increase the medical school student population, going now focus in-state recruitment, really hitting every institution in the state of undergraduate institution in the state of Michigan to make sure that they are aware of our commitment to serving underserved communities. Also to going to some of the minorities serving institutions across the nation to really promote Wayne State. Work closely with the Med Direct program, which is part of President Wilson Scholars, which is a program that allows that really focuses on underrepresented students' opportunity as undergraduate. It's a clear pathway program. If students are accepted into that program, they get tuition paid for, room and board is included, but also too, they get medical school paid for as well. These students need to hit the certain matrix in order to take advantage of this opportunity. But this program is another way that we are committed to increasing diversity here at Wayne State School of Medicine. Also too, another part of my first year is really looking at faculty retention, junior faculty advancing their career and into being senior faculty members, really providing more training, more diversity engagement centered around curriculum. When we talk about curriculum, still today, we still have a curriculum in most across the nation that really doesn't have an adequate representation of people of color in the curriculum. And sometimes this curriculum really focus on deficit. When I mean deficit, focus on racial and structural racism around patient care. And what we're trying to do as a national push is to really focus on the patient's symptoms, focus on not diagnose patient based upon how they identify, but really looking at the whole purpose of what a doctor should do is focus on the symptoms, focus on the patient to make sure that adequate healthcare is being provided for all patients in the
That's
city.
exactly why diversity is so important. I mean, we know that studies show that communities kind of have better relationships with their doctors when the doctors come from those communities, look like them, have relationships with them. We know that there are studies about African Americans not necessarily receiving the same level of empathy from non-Black doctors who may think that they're more tolerant to pain, things like that. So there's some very practical reasons, as you've laid out, for the need for diversity. I'm just kind of curious, what do you see as being some of the chief obstacles for attaining those greater levels of diversity in medical schools?
I think it starts, first of all, it starts way before they get into undergraduate. It truly starts at the 7th to 12th grade when they're at that level. Really, we do a great job across the nation of developing these pipeline programs that really focus on career exploration. Here's what it is to be a physician. Getting role models that look like the students to really see themselves as physicians. But one of the things that we really are, we need to improve on is really providing curricular instructional design, which what mean is getting students more exposed to math and science, getting them really to understand analytical, improving the analytical skills to be successful at the undergraduate level. Because so according to across the boards that, no matter African Americans, Latinx students, Caucasian, Asian students all come in at the same rates of wanting to go in to be a physician. But what happened, what occurs is attrition started to happen when they get into their sophomore year, because some of those gatekeeper courses that some of their counterparts are successful in, they've been exposed to that at the 7th and 12th grade level, where certain populations are not exposed to those that curriculum until they get into college. So the counterparts are pretty much are reviewing the courses while they're first-time introduction. So as they start to take some of these lab courses, and they tend to not do as well, and then they tend to then reapply to other majors. So you start to see a huge dropout at when they become juniors, where you only probably see a couple of the students that look like certain populations in those courses, which results into the small number of candidates applying to medical school, because you need to have a certain GPA. You need to be able to perform well on the MCAT, which is the exam that medical schools use in order to identify the students who are competitive applicants for their program. So it's a lot that we really need to do. And one of the things that we're doing here through my office is we're developing more engagement at the 7th and 12th grade level with providing curricular support. We're coming in and doing more. We're going to develop an MCAT program that really support students who, because these MCAT programs are very expensive, Darrell. You're talking about, if you're a first generation college student, you can't afford $2,000 to $5,000 on a course.
Right.
So what we need to do is provide more equity, meaning we need to provide more resources that will level the playing field for those students who cannot afford to pay for these courses, and provide instructions and support that will allow them to be successful. So I've reached out to some of my colleagues across the nation who have been successful at doing these type of programs, and they're going to consult with us as we develop these programs that we're going to roll out during the summer of 2022.
Okay, well, fantastic. Well, first of all, I want you and I want to thank you and the listeners for bearing with me. I got a little bit of a scratchy throat today and coughing, so I want to thank you for that. But I want to continue on. We're in the middle of this pandemic, like we talked about at the outset. I've been grappling with this thing for about 2 years. We've had a chance to talk about issues such as the racial health gap, the lack of diversity in some of these public health sectors and some of the medical sectors, and the need for more. How, in your opinion, has the pandemic underscored the need for a broader range of medical professionals from specifically underrepresented and disadvantaged communities?
It goes back to something that you said before about what research says. Research says that African Americans and Latinx students are 2 times more likely to serve in their community compared to their counterparts. So when you have a small number of this population who are trained medical profession, you don't have adequate support in order to support the community, meaning that you don't have the access to proper healthcare to really be able to educate the community on this, on the pandemic, and being able to really understand the complexity of some of the things that the community needs in order to be aware on how to better serve and treat, they understand how to stay safe and how to make sure that they are getting tested often. We here at Wayne State, we do our best, and we're doing a good job with some of our students going out and helping out the community, giving free vaccination shots, and really trying to support the community. But when the pandemic hit real hard, especially in Detroit, we didn't have a number of beds. We didn't have enough trained professionals to support our community across the nation. There's going to be a huge shortage in 2040, where there's going to be a need for over 100,000 trained physicians. And when we talk about trained physicians, we really are talking about we need more URIM, which is underrepresented in medicine, once again, to lead the charge and be the next workforce that really fills those open spots that we're going to have by 2040, to really be able to support the community. Because as we hit 2004, we know we're going to be a more diverse community as we see more population growth from certain different demographics. The need for those people to take care of their community is really going to be very vital to the overall quality of health for all in the United States. So we really need to promote more engagement, more opportunity. And the pandemic has really exposed what's going to be our future if we do not get more trained professionals, especially for the URM population going to medical school. This problem really is a epidemiology. It's epidemic. And for like every epidemic, we need a solution. We need a cure, and the way that we can do that is really providing opportunities at the seventh. It started at seventh grade. It doesn't start their freshman year of high school or their freshman year of college. It really should be starting when they hit seventh grade, giving them more opportunities to really be able to expose to curriculum that will build their capacity to make sure that they have the tools they need to be successful in academic.
So more from us in STEM education for our middle schoolers, our elementary schoolers, things like that are important.
Because you're totally right. Because one of the things, science is a very intense environment. It's a dog-eat-dog world, right? And it's a very intense, and especially when you're talking about pre-med students. So it's this mindset: in order for me to win, you have to lose. Oh. So with this quote unquote quotas that everybody want to say that medical schools have for minorities, if you look at most medical schools, you're talking about most medical schools are, upwards to 90 to 95% Caucasian, most and other representation, but you have a small, minute number of Latinx and African American students in those curriculum. So where's this quote unquote minority tax? Meaning where are these quotas being filled if we only have a small number of certain populations in medical school? So that's one of the things that we really need to understand when you're talking about science, is that we really need to help these students build their self-efficacy and be able to be successful in an environment that's already tense and unforgiving towards them, because there's this perceived notion that you're going to get in because of the way you identify yourself, instead of we already know you get it in because of the hard work that you're putting in.
Certainly, yeah, we know that has often been a huge problem, but that's exactly why we're fortunate to have our Office of Diversity and Inclusion and have folks like you coming in and helping to address this problem. I know we're gonna get ready to wrap up. I know you got a lot to do. You're a really busy man, but I just want to throw out one other question to you, and then kind of give you an opportunity to speak to anything else we haven't spoken to. What made you choose Wayne State, and what made you choose Detroit?
Man, you say that the reason why I chose you, because one, I can do the job. One of the things that through my career, I've been in medical education over two decades now, is the fact that really, I really want, one of the holes that I see is that some medical schools that I've been at don't do a good job of reaching out to the undergraduate campuses. They really reach for that cream of the crop, that the top 10%, of students because those students are easy to work with. You know, you need to be able to work with those students who are really the rest of the population. I think that's one of my skill sets. I've been been very successful with working with uh, underserved community because I'm from Inglewood, California. It's similar to Detroit. That's one of the reasons why I moved to Detroit. Detroit is just a cola version of Inglewood, California. The same dynamics, the same people that made up the community of Detroit are the same people that made up my community growing up in Inglewood. So I feel are in Detroit. I grew up in the inner city, came up in a single parent home. A lot of my friends, were getting involved in a lot of shenanigans that I didn't partake in because of athletics. And I really wanted to leverage, my experiences of growing in the neighborhood and going back into the city of Detroit and being able to, understand how to make sure that those students don't end up like some of my friends that I grew up with. So being able to work with the undergraduate campus, Detroit's mission towards serving underserved communities. Wayne State is a very well recognized institution across the nation that really works with BIPOC communities. And I saw that, and also too is something that is very dear to my heart is the fact that Wayne State is really supporting the Black community. And I really, in most institutions, like I tell people here at Wayne State, I have to build an underground railroad for our people because sometimes some institutions that I work with, you have to, explain to them why it's important to really center on the Black community. Here, my first day of meeting with the diversity advisory committee, they were like, they tasked me with, increasing African American Black students on our campus. I was like, man, what? I don't have to build an underground railroad. I can be out front. I don't have to be, I can be out front with this. I don't have to, maneuver and finagle things. You guys really want me to do that? So I'm going to, like I say, February through April, I'm going to be hitting a lot of HBCUs. I'm going to be doing my HBCU and building linkage agreements with HBCUs to really be able to improve our African Americans, but also to going to the Latinx serving institutions in California, Texas, and New York and Florida to really increase the Latinx. And I'm really have building a relationship with the Michigan Hispanic Chamber of Commerce with Mark Moreno, building a relationship to support the Latinx community here in the city of Detroit as well.
Okay, wonderful, wonderful. Well, first of all, we certainly wish you all the best in that role. And I think, there's no more appropriate way to kick off Black History Month than with a reference to the Underground Railroad. So I appreciate that. I thank you for that as well. Now we're going to get ready to wrap up, but I just want to give you a couple of seconds.
Before we leave, there's two more things I wanted that I forgot to mention. So one, I'm going to be bringing out a documentary. I'm developing a documentary that focuses on the roles of social capital and social network that support Black males' matriculations into medical school in the state of Michigan. That's going to be coming out in April. And in June 1st and 2nd, I'm putting together a student athlete conference that really centers around on research. Now, the student athlete conference is a national initiative that I've been working with for the last 4 years to get the way that we're going to increase Black males' matriculation, because since 1978, Black males' number in medical school have been flatlined. It hasn't increased. In some years, it's actually dipped. So one of the things that, that I'm doing in order to make sure that we increase that representation is looking through athletics. When you look at they call PWIs, which stands for predominantly white institution, where you're going to see the most number of Black males enrolled on those campuses is going to be through the athletic program. So my intentions is working with athletic programs to develop programs and initiatives that will help them steer those young Black males into medicine.
Fantastic. Well, we wish you all the absolute best in your role. We welcome you to Wayne State. We're really glad to have you, and we're proud of the work that you're starting to do and the work that you will be doing. We know you're going to be very successful here. So I want to thank you, Donovan Roy, for joining us here on the Today at Wayne podcast, and I hope we can get you back on soon.
Thank you very much, and stay warrior strong.
Absolutely.
Thank you very much.
Warrior strong. Take care, and thanks again.
All right. Thank you.
Thanks for listening to Today at Wayne. We'd love to hear from you, our campus community, about other podcast ideas and topics. What compelling things are you doing to spread the good word about living, learning, working, and playing like a warrior? Let us know by visiting todayatwayne.edu.